Okay, well that's me then, I think. Can you hear me okay, Max? Give me a wave. Yep, all right, good one. Thank you, and thank you all for your participation today. I can't see you while we've got the screen on, but you know, I'm the National Coordinator for Tackling Indigenous Smoking, but I'll touch a little bit on that, you know, in a minute. I'm also going to be talking a bit about vaping towards the end. So, you know, just be aware of that. Can I also say that after I do my presentation, a little bit after, I've got to duck out for 30 minutes to attend another matter, but I will be coming back soon after that. Ben's going to be driving this show for me. So Ben, next slide, thanks. Okay, I'm Kungaraka and Iwaja from Darwin, my mother and father's side, and but currently live in Canberra on Ngunnawal country, and I pay my respects to elders past and present, and particularly our youth, who are going to be our future leaders and who are a really important target group for us as this program is all about. You know, targeting those who need to be targeted, and I'll touch a bit more on that later as well. Thanks, Ben. So look, just as a recap for those new to the program, we're in the third year, just commencing the third year of a 4-year program. It's the first time in the history of the TIS program, which started around about 2010, that we've had 4 years of guaranteed funding, which is important. And you know, that funding does come with some strings, and I'll talk about that. You'll see in that text box there a bit about the program, that it's about funding you guys out in the field. You know, we've also, in this round of funding, we've got to target pregnant women and remote smokers. There's money in there for quitline and quit skills, but I'll touch a little bit more on this a bit later. But you'll see in a lot of my slides that you know, there's web links there, and that's important to have a look at. And these slides will all be put up on TISRIC later. So you know, if you think it's going too fast and you're going to miss something, don't worry. Just go onto TISRIC and you'll find it. Thanks, Ben. You know, one of the key things, as I mentioned, for this round of funding, pregnant women and remote smokers are our big target. And Ben, and you know, the other big emphasis, which I'll touch on a bit later as well, is around about evaluation, and that's so important. And it's like Penny said at the very beginning, you know, our program is one that is continually monitored. We monitor it. We have a continual improvement sort of ethos in what we do. So your feedback is important, and as is data collection. So you'll see why that is in a number of the presentations as we go along. Thanks, Ben. When we launched the program, the Minister also sent a letter out, and what he said, and each of your I guess CEOs would have received this, that this program is a population health, which is all about going out to communities, not to individuals. It's going to be very much evidence-based, and it's got to reach people across a significant geographic area. And it's not bound by AMS regions, even though the AMS or ARCHO may be the host of the organisation. It's about how do we reach those, particularly those who don't attend an AMS. And in fact, the theory and the practice is that each of the AMSs have a responsibility on tobacco control themselves, and that's part of primary healthcare funding. And so that's why they do all the one-on-one brief intervention training, why the doctors and the health workers and so forth do that within our service. And we don't do that. We're outreach. We're out targeting populations and bigger groups, which is a bit challenging during this period. But, you know, I think, and there's plenty of examples, and you would have discussed them anyhow, if you get onto the yarning place, the different strategies that are being used by your colleagues around the nation, and I guess within the state. But you know, it's about how do we get the maximum benefit out of the funding that we've got. Thanks, Ben. The other important thing is that this information we have talked to the CEOs about, so that nothing is new here. The CEOs understand their obligations, and particularly about not utilising TIS funding to prop up what they're doing and what they're expected to be doing in AMSs, and that ours is very much outreach. Okay, Ben. So this slide here, for those that haven't seen it, and you know, is a capture all of what the TIS program is about, and there's many elements to it. There's my role as national coordinator, and that's to work across all the organisations. It's about the NBPU, who provides that support role to each of you. It's about you guys and the roles that you perform. We've now got 40 teams across the nation. We started off with 37, but we've just put on 3 new ones, and Trudy in a following presentation we'll talk about this. And remember that NBPU is your go-to person in what we're doing. You know, we've also got you know, funding. We provide funding to Quit Skills and Quitline, and you know, you got to know all about them and what sort of role that they perform, because it's important. And the other, you know, 2 big elements to it, you know, are the role of the Commonwealth Department of Health, and that's their responsibility of working with each of the jurisdictional departments of health and other people within the Department of Health, Commonwealth. And of course, we've got the state and territories who have a significant role to play, because TIS is not the only game in the town. We've got all the other players, and that includes not only the state and territories responsibility, but the cancer councils and other parties who are out there. And of course, Mainstream has a role to do here. And of course, this money, we've got Trudy and her team in Canberra, who are the policy people and for TIS program, but the administration of the funds and the reporting pipeline is through the FAMs, the community grant hubs. And so, you know, they become very important. And as I mentioned earlier, overlaying all of this are 2 levels of evaluation. And we think that, and the Minister, you know, was very insistent on it as well, is that we have an evaluation of this program, because we have to know whether it's working, and if it's not working, how do you tweak it? How do you you know, not fund programs or whatever, you know, and do it so we get the best impact. And we'll talk about impact a bit later, because I won't cover it, because Raglan will cover it in his presentation, as will, I think, Trudy will touch on it as well. But we have 2 levels of evaluation, and one is run by CIRCA, called Part A, and Part B is the bit that's run by ANU. And you'll hear about ANU, and I'll talk a bit about CIRCA in this next slide. Thanks, Ben. CIRCA couldn't be here, and you know, mainly because, you know, the program is very restricted. So I'm going to just do a little bit of a sell for CIRCA's activities. And you would have been in touch, but CIRCA's role in their evaluation is to look at implementation, appropriateness, and outcomes. And you know, that's really important. They're the 3 big elements that we're assessing on the ground to see whether the program's working. And there's a whole program of this. Now, CIRCA does have a video that's on TISRIC, which will go through and talk a lot more about what they do and how they go about their business. So I really encourage you to have a look at that. So, and that's an important one. Thanks, Ben. So one of the things that they're doing is looking both at qualitative and quantitative data. So one is looking at statistics and that sort of stuff, and that's the quantitative. The qualitative is where they have a chat to you, and this is just an outline of the sort of people they'll be talking to. That's virtually everybody who's part of the TIS program over the next couple of years. And it's going to be important that they look at the priority areas like the remote and very remote smokers, and also women who smoke. So they'll be conducting a lot of their business over the telephone, and they'll be in contact with you. And I know that they've already been in contact with WACS and so forth so far this month. But they'll be interviewing everybody and collecting this data and to really progress and be able to provide a compelling story to government as to why they should continue funding us. Now, there's not saying that there's any doubt. I think that, we're a very successful program overall. So, funding should happen, but you never know. So we're going to make sure that we have the data that they can look at. Thanks, Ben. Now, this is just a program of activities between now and November. They tell me that they've already spoken to WACS, so they'll be there. But each of your services, whoever the contact person is, will be contacted, and they'll be referring back to things like your activity plans and seeing how they go. And that's the quantitative data that they'll be looking at. Now, this next slide is an automatic slide that'll happen, and it's Penny giving us a bit of a spiel about how the relationship with FAMs and getting your reporting in. So just bear with us, and it'll happen automatically. And I won't talk, but you'll hear Penny. Go, Ben.
So just to begin, let's think about the reporting process and remind ourselves what happens. So you draft your progress report and then send it to us at the NBPU. You send it to us 4 weeks before the final lodgement date. So this time around, that's going to be the 31st of August. We will then review your report and we'll provide you with some feedback within 2 weeks after that date. That then gives you another 2 weeks to make any amendments and send your final report to the FAM. Once the report has been accepted by the FAM, the report will then be shared with us. And there is an important reason for this, because the process is not quite finished at that point.
Now, that finished very abruptly, which is just bad luck. I didn't do a very good cut and paste of it. But as I said, the whole report is up on the website, so you can on TISRIC, so you can hear Penny tell us the full story. Now, the one thing, and Max, you might just circulate again through the chat line, because I think there's been a reviewed date. Penny mentioned the 31st of August. I think it has been extended, so you might just want to confirm that with everybody as to when that'll be. Now, people have often asked why do we have a remote as a focus? I guess this is just a really quick snapshot to look at what's happening in the tackling smoking space or Aboriginal Torres Strait Islander smoking. What you can see is that the green line, which are people living in remote and very remote, that's pretty much flatlined. We're not seeing any really changes in that area. Whereas when you look at urban and in a regional, in a rural, we're seeing good progress. Now, I'm not going to go further than that because Raglan and Trudy will unpack that a little bit more. But that's why we got remote as a target, because of the lack of movement in that area, and why it's a big priority. And for WA, the vast majority of you guys are in that demographic and that target area. So, we've got to look at ways in which we can lift our game out there, or I shouldn't say that in a derogatory way, but how we can have a better impact. And we're going to be doing some work with NBPU it was scheduled, but it's been unscheduled now because of COVID, to pull together a regional workshop. But some of the work is being done already in the Northern Territory that Trudy will talk about, which will give us maybe some guidance. Okay, thanks, Ben. Now, we often talk about the health impacts of smoking and why we've got to give it up. But I think, you know, one of the things, and a couple of these slides, a number of these slides that I'll present are really resource slides for you to understand that whilst health is critically important because, you know, it does take many of our people out, the economic impacts are also very significant. And the government each year, you know, adds a little 12.5% excise to the price of tobacco. And so that happens in August or September. And it's just happened at the moment. So cigarettes will be going up, and that's going to cause pressure, stress on people. And so, you know, it's an important that we look at. Can you touch it again, please, Ben? It's important that we look at because the stresses are real for people who are addicted to smoking, and we need to do it. But we also need to understand that, you know, wealth is an impactor, and it's one of the determinants. Poverty is one of the determinants we look at in health to ensure that we address the whole spectrum. So it's not just about interventions when you get crook, it's about all the prevention. It's about addressing things like overcrowded homes, smoking, you know, poverty, which is one of the biggest, you know, impactors on poor health. So that's just there for your info to understand the relationship between smoking and wealth as much as. And this next set of slides, Ben, really does show it. And this is based on you know, the recent data shows us that Bush stores are selling a pack of 20 for $40. So it's basically going up to nearly $2 a stick. In an urban environment, it's probably down to about $1 or just over, but it gets much higher out in remote areas. And so that's a significant impact. And these are just slides that you can use, and I'd really encourage you to think about this and understand it, because in that yellow box is a reference to the Job Start allowance and New Start, basically, and how much people get a fortnight, you know, whether you're single or whether you're not. Now, why that's relevant, Ben, next one, is that on Job Start allowance, which is around about 14.5 grand a year if you're single, and a couple about 26. But if you have a look at these slides, you can see that if you're a packet of smoker a day of 20, no, not go back one, Ben. Yeah, if you see on there that you're spending almost your full allowance of Job Start on cigarettes if you're smoking a packet a day. So people have got to understand that this is one of the reasons why they don't have the money, and also it's one of the impactors of stress. Now, you know, there's a lot of evidence around to show you that, you know, stress is not good and people smoke because of stress. But there's also other evidence, and David Thomas talks about this, and I think he's coming on a bit later. I might talk about it's also an opportune time for people to give up smoking and take it up. So that's an important relationship when you're talking to groups, is to use a slide like this to be able to demonstrate that it is an impactor. Okay, now, thanks, Ben. Now, this one's just for you, a quick reference. I talk about it all the time. Smoke-free workplaces. This is the ORIC, Office of the Registrar of Indigenous Corporations. 3,500 Indigenous organisations across the nation. You've got 700 or 800 of them in WA. And, you know, if every one of those organisations had a smoke-free policy or engage with Quit Skills or knew what services we had and had a very proactive approach, we will make an impact, very big. Now, I'm doing some work with ORIC to try and look at it from a systemic way to address all their organisations, but in your plans, you need to be targeting all the Aboriginal organisations in your region. Just go to the ORIC website, you'll find out where they're at, and we're in fact we're currently developing up an app that will show you that that sort of data anyhow. But I just wanted to say, remember that targeting Aboriginal organisations, targeting community control health organisations, your hosts, to make sure that they have smoke-free policies and actively implement them, we will make a difference just through those measures alone. Okay, thanks, Ben. A bit of a plug for the NBPU newsletter, and also the monthly TIS communique that goes out to FAMs, to all the state and territory jurisdictions, major stakeholders, so that we're trying to include everybody from yourselves right through to our major stakeholders to understand what we're doing in TIS. So they're both very useful resources, and of course they're up on TISRIC. Next one, thanks, Ben. And this is the TISRIC site. You know the website, so I won't go into it, but just a reminder that this is your go-to place. This and the NBPU are who you need to be working with if we're going to be impactful and we're going to make a difference. And of course, Desley tells me that the yarning place is becoming very, very popular and well patronised. Okay, thanks, Ben. And that's the yarning place anyhow, which was what I just mentioned. But you know, social marketing is important, especially for a population health approach. It gets your message out very quickly. You know, and as Desley may have mentioned to you, that, you know, use the yarning place, which only you guys can access, and unless somebody else is invited in, it's an opportunity for you to be able to sit down and get your development, talk about issues that you want. If there is something you want to specifically know about, you know, for example, more details about vaping and so forth, just mention it to Desley or Max, and you know, we can dedicate a yarning time for that. Okay, Ben, thank you. The other resources around, and you know, is COVID-19. The whole lot of business that we're doing is changing because of COVID-19, but there is a relationship. You know, our mob who smoke are more vulnerable, but fortunately, we've only seen less than 150 people affected, Aboriginal and Torres Strait Islander people affected by COVID-19, and from our sort of understanding, no Aboriginal person or Torres Strait Islander person has died so far. But those resources are there, the links are there to have a look at. Ben, thanks. And again, I mentioned earlier about the stresses. We've seen that this is a great time that people now, when you've got the excise increases, when you've got COVID-19, people are restricted at home, got to talk about no smoking, you know, and the impacts of secondhand smoke, but it's also a great time to contact Quitline. And the evidence globally is showing that more and more people during COVID-19 are contemplating or trying to, you know, address smoking. Okay, Ben. So you would remember earlier this year when we had World No Tobacco Day, it was all about, the focus this year was about the impact of big business, big tobacco, and how that's influencing kids. And one of the ways that they're doing it is particularly through vaping, but it's also, you know, why we say it's through tobacco, smoking and nicotine, and that's through vaping and other measures. Thanks, Ben. So I want to just look at vaping because it is you know, evidence is showing that it is not rampant amongst our people, particularly in remote communities, but it is in urban environments, and not just with Aboriginal Torres Strait Islander people, but everybody. And this is just a really, you know, just a slide. There's a link there. This is a great little video clip on YouTube that you can have a look at, which will give you a lot more information. But when we see that 73% of teenagers are trying out vaping and they'll get hooked, and remember that a lot of the vaping propaganda is promoted by Big Tobacco, and they're out there to encourage people to take it because they control a lot of the e-cigarettes, around the world, with the exception of what we get over, I don't, but what people get over the internet out of China and other high risk places. So that's just worth looking at. It's worth remembering that it is something that we have to be very conscious of, and that as there's a whole lot of work. And if you go to the next slide, thanks, Ben. A lot of what's happening out there is that Big Tobacco is trying to influence people, and so and to encourage people to take up vaping. Now, some of you may have seen a similar letter to this, and this one went to Ray Lovett, Raylan's colleague, and it's just about Big Tobacco. Thanks, Ben. And it's an invitation to discuss, harm reduction and smoke-free nicotine products, aka vapes and electronic cigarettes and so forth. So it comes out as if it's a really, we're trying to help you out, whereas it's not. So it's they always talk about significant research in these letters and these invitations. Thanks, Ben. And then you see they have that disclosure. Yep, this is all about Big Tobacco has engaged this company to do it. And of course, Philip Morris is one of the big ones that's out there. They've invested into the Philip Morris Institute and run out of New Zealand, offering big money for research, come and partner with us, etc., etc. What we ask is that if you receive a letter like this, anybody who's approaching you, please alert Trudy and her team or the NBPU who will bring it to our attention, because we know it's going out to Aboriginal organisations. We encourage you not to participate, but to alert us, and we will move on to it. Okay, thanks, Ben. Now, I wanted to quickly go through just talking about the TGA, Therapeutic Goods Administration. They're the overriding body in Australia that approves the sale of therapeutic goods or drugs, and not illicit drugs, but medications and so forth. And what they've come out very recently, with advice, but basically what they're saying, and this is on their website. I've given you the link there for you to go and have a look at, because if you're one who's out there who thinks, oh well, yeah, vaping's good because it's a harm reduction, it's a way to give up smoking. You can't promote it if you're a TIS employee and one of our workers. We're totally opposed to it. So is the Therapeutic Goods Administration. So is the Australian government. And so, it's not your place to be out promoting vaping and so forth. So, none have been proved to be good for you. Thanks, Ben. And, it's if you think you need to go and get, or anybody asks you about what they need to do to give up smoking and should they take up vaping, no, refer them to their GP, their doctor, and get them to prescribe. They can prescribe nicotine products to very, very heavy smokers, people who are totally addicted, and that is very closely monitored because nicotine is considered a poison, and they can go through that product. But as you know, there's a lot of NRTs that are available out there. And thanks, Ben. And so you've got both the approved NRTs and other ones that you can get over the counter. So it's important that you have a look at that. And again, Ben, and the TGA gave a decision just on the 20th of August, which really does make it very clear about what why they go through a whole argument, reasons why they find vaping is just not acceptable, and nicotine products for sale to the public without prescription are unacceptable. And I'll be putting some more information on this on TISRIC and through the MBP newsletter. Okay, second last slide, or last slide, really. Just on this to say that, you know, we have got to be diligent. We've got to be in all of our public health promotion. When we're out there talking about tobacco, we've got to, you know, take that responsibility ourselves to remind people to look at the hygiene aspects, washing hands, social distancing, stay healthy, go to the doctors if you've got a medical condition, and, you know, regular stuff. We can do that when we do our tobacco stuff. You know, that little box in the corner there with those graphs, I think, is really important, because it shows during the COVID period, the common flu is way down compared to previous years. And the little green graph shows what it has been in previous years versus what it is now, the brown graph, which is way down. So that's in itself a good enough reason why we need to maintain some of these really good hygiene practices. And you know, I gave you the link to the flu tracker, which is a program in Australia and New Zealand that every week, you know, you get an email and ask you whether you had any flu symptoms, etc. And that's how they get this database. I'd really encourage you, if you're not on it already, to go in there and sign up. It's free, and it's great to get the data together so we know where it's happening. And like I use it, I can go in and put in my postcode, and that will tell me how many people in my postcode are affected by the flu. And so you can know whether well, it's a bit of useful information, not really useful, but it's interesting information. Then finally, all that information out there on coping during COVID, really important. The Gaia Dewey Proud Spirit Australia website is really good. It's got a ton of material on there that we can look at, and I'd really encourage you to have a look at that website and you take it on. So I think that was it from me. But look, you guys, you stay healthy, eh? And you know, we've done a great job so far. We just got to maintain our vigor in what we're doing, and really encourage our mob to you know, take that leap of faith and try and give up if they're a smoker. And you know, there's still opportunities to hit those schools and so forth, and people are doing it. We're just doing it electronically, not face to face. Although in many jurisdictions they're still able to travel, whereas we in Canberra are not allowed to travel out to some places. But thank you, and yeah, I'm going to take your leave for a half an hour and about 10 minutes. So if there's any questions, I can quickly respond. Otherwise, we can do that a bit later. Over to you, Max.